Let me bring it a little bit back for you. Okay, there you go. Hi everybody. We're gonna go ahead and get started. I know that people will be coming in for the replay. Go over this way. Oh, okay. You're gonna have to hand that to me. You're gonna have to hand me something. Tonight, Alex is gonna start the first series that we're gonna be doing, and the first one that he's gonna be doing is on advocacy. We are going to do several different series. The first series being called The Doctor is In, and that's where he's going to just talk about, this is awful. I can't wait till we get home with no kitchen and everything. So the point of this series, why don't you just tell them what the point of this specific series is going to be?
It's going to be to discuss different medical issues. It's going to be topics that actually you're going to suggest. There are some that I really want to do just because they cover such a big part of our population. So we're going to discuss true emergencies. What is a true emergency and how do you respond? Respond either the ER or 911. We'll get into that in a future live. Then we're going to cover big topics like high blood pressure, diabetes, heart disease, stroke, abdominal emergencies. Now, abdominal emergencies sounds like a big topic, and it is, but the abdomen doesn't have a whole lot of stuff in it that can take a joke well. So if you have abdominal pain, especially persistent abdominal pain with other symptoms, and you know who I'm talking to, you should probably go to a doctor. If it's bad enough, go to the emergency department. So we're going to discuss big topics throughout the year. And then we're also going to answer your questions. And then if you have lecture topics that are of special interest, then please put them in. And I don't know where you put them in, but Amanda does, and she'll tell you.
Okay, so there'll be different series that we're going to do because we are still going to do the shark tagging, taking you guys out on the ocean conservation, showing you how we work with NOAA and OSearch to do the shark tagging and stuff like that. It's just that right now, because of the hurricane, number one, we're in Chicago, and number two, there's all kinds of really bad stuff out in the ocean right now. So I think when we head back, probably the first few videos will actually be us doing some cleanup of the ocean, because right now anybody that's out on the boat, they're kind of asking them to try and do some cleanup, because I mean there's houses, there's a lot. And okay. On top of that,
we were waiting for that.
On top of that, there's also some red tide and some different blooms that have hit in Fort Myers that are killing off some large mammals. It happens a lot with smaller stuff, but not usually the larger animals. So I am going to go ahead and I'm going to turn this over to Lex and let him go ahead and talk about advocacy. And then I will be on his phone and I'm going to try and answer you guys through the telephone rather than interrupting him as he's talking. And then at the end, I'll come back on and we'll kind of do a summary and talk to everybody. So when you see me chatting with you in the chat, that's me. He's going to be talking about the subject. So enjoy, sweetheart. I'm going to scooch over. I love you too. Scooch this way. So what do you say where you're at?
I'm going to stay where I'm at because
I'll accommodate you.
The little dog is right behind me. And if I move, who knows what's going to happen.
I feel like it's too.
So I am going to discuss advocacy. And what does that mean? That means that when you are going to your doctor or your medical provider, because now a lot of people are seeing nurse practitioners and physician assistants in addition to their main doctor. So advocacy means that you have to be prepared. And that is a word that if this were a sentence, I would underline over and over again. Be prepared. That means that prior to going to the doctor, your primary care provider, or a specialist, the emergency department, the urgent care, know in your mind what you want them to know, because they're going to start listening. And as soon as they start listening, they're going to try to start doing a differential diagnosis. They're going to be thinking about any tests that they're going to have to order. They're going to be thinking about medications that you might require immediately if you're in pain. medications that you might require immediately if, let's say, you have a seizure disorder and you're having an aura, which is the feeling that the seizure is going to come on, and thinking about medications that if you do get to go home, that they're going to prescribe for you. So although you're talking, they start thinking, and they may not be listening as acutely as you want them to. So be prepared with your questions, your comments, your concerns, and there is a excellent way to try and order this. So I'm going to go through several topics, and it's going to be like an outline. If at some point in time in the future you say, yeah, I really want to have my medical history in this outline format, just let me know and I will write out an outline for you, and then you can just fill it in. The best thing is, before you go to the medical provider, you have a little laminated card with all of your medical history, with your medications. And if you're going to the doctor for, let's say, a routine visit or some new symptoms that is not necessarily emergent, you want to write out questions to make sure that you ask all the questions that you want answered so that you feel comfortable with the treatment plan. And you also want to get all the questions out that you want the doctor to answer for you so that both you and he or she understand what is happening and what is the next step. So an easy way to think about being prepared for your medical visit is, number one, to have written down and to have in your mind a past medical history. That means all of the medical problems for which you're being treated now, and also medical problems that you had in the past. So what does that mean? Medical problems that I had in the past. Why is that important right now? I will give you an example. Let's say as a child, I had a seizure disorder. Now the seizure disorder has resolved. I grew up, I never had another seizure. I go to my doctor and I strained my back. And my doctor said, okay, well, we're going to get you some medication. Well, some of the medications that they use for pain can actually trigger seizures in people that don't have a history of seizures. And if you do have a history of seizures, you will be more prone to having a seizure. So that's why it's important to include your childhood history. Even if you're an adult, you want to include that when you are seeing your medical provider. Another example, let's say that when you were a child, you had strep throat, and strep throat can lead to scarlet fever. And that can actually lead to rheumatic heart disease in later life. So you want to tell your doctor, I had strep a bunch of times, I think I had scarlet fever, and then they will make sure that they're screening you for rheumatic heart disease, which is heart disease that can affect the valves of the heart. So your past medical history, both present and also past. It doesn't matter how long ago, it is important. Past surgical history is important. You want your doctor to know what kind of surgical problems you had. It doesn't matter if it's a tonsillectomy or it's open heart surgery. It's all important because your doctor wants to know what kind of symptoms you had before, what kind of medical problems you had before. And in addition to that, they are going to ask you, did you have any problems with anesthesia? That's an important one. You don't want to go into another procedure where you might become, where you get anesthesia or analgesia. So anesthesia is you're being given medications to sleep and they're going to help you breathe. Analgesia is pain medication, basically to alleviate pain. And then sedation is medication that will make you sleepy, somnolent, but you're able to breathe for yourself. So sedation would be used for a painful procedure, like let's say you dislocated your shoulder or you had a broken bone and it needed to be set. The analgesia is having a tooth worked on or having a laceration and it has to be numbed up. That's analgesia. And then anesthesia is for bigger procedures and especially for surgical procedures. So I tend to talk and talk fast, and I get into a rhythm, and it's hard to stop me. So I've given myself little breaks.
Hey, I can't bring up the chat on the other telephone. I have absolutely no idea why. Hi Janice. Hi Sea Monkey. And I don't think I can
Hello,
go
doll.
back here either. Does anyone know how I can do that? I've never ever had this problem before. I mean, I can see everything, but I can't see the chat or anything. It's really weird.
Hopefully, we're still fairly early into this particular live stream. If somebody has sent a message or is in the chat, maybe you could put it in again so that we can catch up with that.
Yeah, see what I mean? Like right here, see how the chat thing is right there?
Yeah.
Look, there's nothing. On your phone, it won't let me chat. I don't understand.
It's because my phone's from the last century.
Yeah. Janice, I know that you're still in there. Is the signal okay, or do I need to turn the Wi-Fi off and just go on 4G? Because I'm not sure how great the Wi-Fi is here, but I know our 4G would be good. Mr. Lex, have you heard of PNES?
I'm not sure exactly what that is.
Great signal. Okay, great. Thanks, Janice. Sea Monkey, are you Donna? Are you Miss Donna? If you're not, or I guess if you are and you want to be known as Sea Monkey, I should just shut up. But I don't know why. I don't know why. But when you asked what that was, he's gonna write it down right now, aren't you? I knew it.
Yes.
He'll find out. Yeah. Okay. Good. I just wanted to make sure. He'll check on that and let you know. He's also checking on a couple other things. Just real fast, we are gonna pray at the end, but I just want to mention that everybody praying for Miss Nancy was wonderful. Her mother went through surgery and came out doing fantastic. So praise God. Of course, we want to continue prayers for, healing and a quick recovery, and also for Miss Nancy. It's an incredible amount of stress and worry. And I really want to lift up Hope. Continued prayers for Hope as well. But in your dreams, I really want us to be mindful of her and lift her as much as we can tonight. She is really going through it. She has a lot of things going on, and she's also trying to deal with the loss of her mother. That's going to be 2 years very, very shortly. So if you guys could just please lift all of them up and send some strength to them, and maybe send them a note. Just let them know that you're thinking about them and that we care, that they're on our hearts and in our minds. That would be wonderful. And I want to thank all of you that have come out and prayed just from our community page. It means a lot. It means a lot, not just to us.
It means a lot, and it works. I will tell you that in my career in medicine, I was able to do a lot of things that I really didn't think that I would be able to do. A lot of interventions, a lot of procedures. I've delivered more babies than most, but not as many as an obstetrician. And I had some emergency deliveries that I'd read about in a book about 20 years previously, and I had never done it. And yet, thank God it turned out well. So prayers always work, and always be mindful that there is more to you and more that you can do than you even know. So
yeah, just one more thing I want to say before I step back out and let him go back to the advocacy is one of the major things that I just knew. I knew he was the one, which I knew pretty much right away. But one thing that really stood out to me was when I was walking by one of the patient's room, and he was in there with a patient and the family, and he was on his knees and he was praying with the family. And I just went to my friend, her name was Erin, and I'm like, I am so gonna marry him. He is praying with them. It was the most amazing thing. Can you see what it's about? Epilepsy. I don't even know what it is, and I have epilepsy.
Yes.
Thank you, Janice. Okay. Thank you, Janice. Okay, I'm gonna step back, you guys. I'm gonna try and download the app onto his even older phone than mine and see if that works. And I'm going to let him go. You're about 15 minutes in, just so you know, right up here is your time. But
Okay.
you've only been talking for about 7. We know how that goes. Ran my mouth.
All right. So the things you want on your list before going to the doctor: past medical history, past surgical history. You don't have to necessarily remember every single detail of it, but big details: the name of the procedure, and also your response to any medications, which leads us into the next thing that you always want to have listed, and that is your allergies. Medication allergies, but also non-medication allergies. So a lot of people have egg allergies, and eggs are used in a lot of medications. Peanut butter, protein allergies, any kind of allergy, you want your doctor to know about it. And I mentioned allergies before I mentioned medications on your list, because like I said, once you're talking to the doctor, he's going to start thinking about what medications he may give you to treat that. And if you list the allergies before you list your medications, then he's going to pick up on that and maybe guide his thoughts towards a different type of medication. So next thing on your list is your medications. You want all of your medications with the dosage and how you take it. You take it twice a day, and it's 10 milligrams, and it is drug alpha bravo. And then you also want to, excuse me for clearing my throat, you also want to list old medications, previous medications, especially if they are for a ongoing medical problem or a chronic medical problem. So let's say you have high blood pressure and you're on a medication right now. You want to tell the medical provider about medications you used before, because they're going to say, well, why don't you use that one anymore? And the answer is going to be an allergic reaction. It caused swelling of my tongue. It didn't work. It was too strong. It wasn't strong. It wasn't strong enough. I used it in combination with this medication, but then I didn't need the combination. So now I'm just on this medication. So you want to have a list of all of your medications. And in addition to your medications that are prescribed, you also want to tell your doctor about over-the-counter medications, because sometimes you may not read the fine print, and you may not realize that there might be a interaction or contraindication when using an over-the-counter medication with your prescribed medication. The other thing you want to do is also list all of your medication supplements. So multivitamins, stuff for, let's say, joints, fish oil, which is supposedly good for your heart, or red yeast rice is supposed to lower your cholesterol. So if you're on a cholesterol medication and you're taking red yeast rice, you may think, well, what's the problem? Well, the problem is that too much cholesterol is bad because it can cause blockages in veins and arteries. But not enough cholesterol means that you don't have enough fat in your system to actually form the linings around nerves, and it can actually lead to the breakdown of nerves. So those are just some examples. So your medications prescribed, present and past, your medications that are over the counter, acetaminophen, Tylenol, ibuprofen, Motrin. They're the same thing. I'm using the same word for two different medications. Sudafed that you take for a stuffy nose. You may not want to be taking that if you're on high blood pressure medication. So bring it up to your doctor. And then any multivitamins or any other supplements that may interact with your medications or that are good to supplement your medications.
Okay, here's a good question for you.
Good question.
Yeah.
They're all good questions.
They are. And I wanted to say hi to Mad Chatter. I'm sorry that I missed you. So a question from Craig, and you remember he was with us last time. He said, how are things, Doc? Any idea about what to do with a nagging wife? After 42 years, had enough of it. Laugh out loud.
The best thing you can do is, and this was told to me at my wedding, not the first wedding, because there's a second wedding means I got divorced. So second wedding, it's, yes, dear, you're right. I'm wrong. This will never happen again. That's the best advice.
He said, yeah, I've done that. It's been 42 years. I'd say he's probably done. I'm just gonna don't kill her. That's it. Just don't kill her. Hi, Bonnie. How are you? That's okay. Get some rest. We will definitely put you on the prayer list. I will do it right now, Bonnie. You're added, and I will make sure that I add you to the prayers for tonight. While he's taking a little break, does anybody else want to ask any questions or anything? Craig, thank you for jumping in and lightening the mood. That's super sweet. We appreciate that. It was a great answer, right? You're welcome, Bonnie. We love you. We definitely will be lifting prayers. And you have my cell phone, all right? Hi, Ray. Hi. How are you? I absolutely love your accent. I just love your accent. Yes, that was good. Okay, I'm going to go back to the chat and let him take over. You're on allergies and stuff, right? Okay.
I'm beyond allergies.
Okay, and we're at about 20 minutes. I'm sorry.
All right. When we are talking about medications, the other thing you may want to add to your list is immunizations. I know this is a hot button topic, so if you ask me which immunizations I recommend and which I do not, I will not answer you because I will get kicked off. But offline, I'd be more than happy to discuss it with you. There's no answer. There's no right. There's no wrong. There's research. I'd be happy to discuss it. Discussing it over this medium is kind of fraught with danger. So get me off the YouTube and we can discuss it. But immunizations are important. If you have this funny little rash and it's itchy and it's between your ribs and you go to your doctor, he's going to ask you, have you had a shingles vaccine? Because that sounds like the first symptoms of shingles. If you have, then they're able to do another workup. The other thing is some people don't have good reactions to immunizations. I'm not asparaging the current immunization that everybody else is discussing, but more simple stuff like the influenza vaccine or immunization that comes out every year to try and battle what they think are going to be the prominent flus. Some people have a bad reaction to that. They'll always tell you, no, the flu vaccine doesn't cause the flu, but the flu vaccine can cause an immunologic response that will perhaps give you fever, chills, headache, muscle ache, joint ache. You may not feel well. You want to discuss that with your doctor, whether the benefit of the vaccine or the immunization outweighs the symptoms that you have. And the symptoms for most vaccines are usually self-limited. So discuss with your doctor immunizations. The discussion may not be just the immunizations you have. They may suggest some, and you want to be informed about the immunizations. So the Center for Disease Control has a list of immunizations that are recommended for different age groups. Be prepared. So if you're going in with your child for their childhood vaccines, you can read up on them and then make an informed decision when your doctor says, is your child ready for this? As an adult, the flu vaccine, the influenza vaccine, pneumonia vaccines, the shingles vaccine, you want to do your own research, ask your doctor, and then come to a consensus about whether you're going to get the vaccine immunization. All right. Is there a pause indicated, or should I roll on?
No. Miss Dunham, or I'm sorry, C wanted to know, do doctors really care about their patients? And her second question, where did it go? Do you miss working in the emergency room? Shh.
The emergency department is something that is made for young men and women. Sorry. Yeah, that was insensitive. Young men and women. When you're in your 30s, it is exciting. Everything is a challenge. And then after a while, your back starts hurting because you're on your feet all the time. You start getting tired. You start getting grumpy. And that leads into, do doctors care about their patients? And I'll tell you, good doctors care about their patients. Now, are there some good doctors that may not be able to emote that fact, that they may not share their desire for your best result? Yeah, and a lot of people will say, I'd rather have a grumpy doctor that's not very nice, but is a good surgeon, as opposed to a really nice doctor that is a bad physician or a bad surgeon. But I will tell you that, yes, I always cared about my patients, and I carry that on. There are a lot of things that, like I said, turned out really well, that I'm really happy with the outcome. And I may at times remember that a little bit every time I lost somebody. The younger, the worse it was. So, children, I remember almost every single child that I lost in the emergency department or that passed away soon after I saw them in the emergency department. So, I will tell you, yes, there are a lot of doctors that are like me, and there are a lot that care about their patients. And that's where we get into the next topic, your doctor. So your doctor, if you're seeing a current primary care doctor, they may ask you, who was your previous doctor? And tell them who your previous doctors were and why you left them. It was too far away. They didn't take my insurance. We didn't agree on medications or immunizations or treatment plans. My previous primary care doctor referred to other groups, and I preferred to work with your group. So always tell your doctor why you're seeing them, and then also why you left other practices potentially.
We're good. You can keep going.
All right. In
Hi,
addition,
Jenny. Sorry.
in addition to your primary care provider, you also want to inform your primary care provider and whomever else you're seeing that you are seeing specialists. So if you have a primary care doctor and he's handling your high blood pressure and your diabetes, you also want to tell them, I'm also seeing a cardiologist. Oh, that's great. Okay, well, we can discuss with which medications you're on in terms of your cardiac medications with your cardiologist. And that's very helpful. If they can work together, a lot of times they can come up with a medication armamentarium, a group of medicines that work the best for you. So two minds are better than one. The specialist may have some exposure, some new research that shows different medications, different procedures are better for you. So always tell your doctor, whether it's your primary care doctor or a specialist, what other doctors you're seeing so that they can work together on your medications, on any diagnostic tests, and on your treatment modalities, whatever treatment is necessary to keep you in good health.
And should everyone have a primary care physician?
Absolutely. Yes. Everyone should have a primary care physician. So that would be like asking, should every major sports team have a coach? Well, it's the athletes, it's the superstars. It's your cardiologist and your brain surgeon and your orthopedic surgeon. They're doing all the magic stuff, aren't they? Well, without that coach, without that primary care doctor, the orthopedist may not communicate with the cardiologist, or they may not, even though they went to medical school the same, they may not speak the same language. The orthopedist is focused on bone and joint health. Your cardiologist is focused on your heart health. So you want that primary care doctor to have all the information from the orthopedist, from the neurologist or neurosurgeon, the brain specialist, from your cardiologist, immunologist, a pain medicine specialist. Your pain medicine specialist may want to talk to your orthopedic doctor or your rheumatologist. Rheumatologist deals with chronic conditions of the joints, like rheumatoid arthritis or psoriatic arthritis. So you want all these doctors to be able to communicate, and a lot of them will communicate through the primary care doctor. He gets reports from all of them, he collates those reports, and then he decides on a treatment plan with them, but also communicates with the other doctors so that you have a consensus opinion that is the best and the best treatment modality for you. Another thing, and this is kind of off topic, that I did want to discuss somewhere in this Doctor is In series is chronic pain management. I know there are a lot of people that are in pain management and have chronic pain, and I wanted to discuss that. That was a big research topic that I did about a year ago, and I wanted to discuss that. So if there's interest in that, please let me know. I'll probably do it because I know that there are a lot of people that suffer from chronic pain, and they are either undertreated or sometimes, unfortunately, untreated.
C said after she asked if everybody should have one, she said that she doesn't currently have one. So I would definitely suggest that you do. I'm pretty sure the way he explained it was perfect with having a head coach, but you still have to have, you want to have somebody that's in the center of everything. So just like in a wedding, you have your wedding coordinator that carries all the other stuff, that takes care of everything. That way you don't have to be that person. So you want someone that everybody else reports back to, and he has all the information, or she has all the information. That way you're not trying to do it. So the best thing that you could get out of this entire lecture that he's doing would be, yes, you absolutely need to have your own primary physician to handle it. Is it dangerous to stop a statin if a person was on a low dose? Oh, where'd it go? For a year, can they toss it if they don't like it?
Don't like it is different from don't need it. Statins are not one that is dangerous if you stop it, but I would say stop it in consultation with your doctor or whomever prescribed it. It may not be your primary care doctor, it may have been a cardiologist. Statins are important if you have had a previous heart attack. If you've had a myocardial infarction, an actual heart attack, if you have a stent in your heart, or if you've had bypass surgery.
And see, if you have any problems or you're not exactly sure who to go to, or you want some assistance with that, let me know. Alex can look up the primary and probably like internal medicine doctor is probably the best way to go. He can look up who's in your area and give you some suggestions on who might be good where you're at.
Yeah, exactly. If you do have a problem finding somebody, it's overwhelming. There's too many. You don't know whether you should go to family practice or internal medicine or general medicine. Contact us on the offline, not on YouTube, so that we can make it personal. And then I will get what I just talked about, past medical, past surgical history, what medications you're on, and then I'd be able to more fine tune a practice group that would serve you the best. Going back to what Amanda said in terms of the coordinator as your primary care doctor, the other thing your primary care doctor should do is be your explainer in chief. So if you go to the cardiologist is going to talk to you like a cardiologist talks to another cardiologist, probably. The same with other specialists. They are highly trained and they talk in a certain vernacular. They use certain terms and they may or may not explain everything to you. But your primary care doctor, when you get a let's say a stress test report for your heart from the cardiologist, he'll want to explain it to you, because when you get a report from a radiology test or from a stress test or even a blood test, you can get it on stuff like My Chart, where you can actually pull up your results within a day or two of having the test done. But there's a lot of words there that if you don't have medical training, they may not make sense to you. You look at the test and then you start typing on the computer, you start Googling different terms, and you get into some explanation that now you may have beriberi, lowi loa, or a hairy nevus. Now, nobody probably listening knows what any of those are. They're all medical conditions, but they mean nothing to you. And if you start looking at too many websites, it may actually confuse you. Worse yet, it may actually make you nervous and anxious. And not to disparage my friends at WebMD, you're a fine website. I am not disparaging you. I'm just saying some people don't get all of the explanations there. So have your primary care explain to you. If it's not adequately explained, that's part of what I want to help people with. Find somebody who is an advocate that can also explain for you.
Okay, we have some more questions.
Excellent.
I know. So Miss Janice, she asked if a fall could exacerbate her vertigo, which we were talking about before this.
Yes.
And then I have two
Simple answer.
other questions. Oh, okay.
And we can discuss again offline why that's true.
Thank you, Craig. It's nice to see you. Craig is from WOG, so thank you,
great.
WOG.
Yeah, we love that.
Yes, and I believe Pink is also from WOG, so thank you guys so much. We see you. It's
a
wonderful to see you.
Good crowd coming from WOG.
Yes, and you remember We See You. She did that great video with the siren.
Mm-hmm. Yeah,
Love it. That was so funny. Okay, the next question. Actually, Janice did ask if it would be temporarily worse. Will it improve also? I'm sorry, I asked that wrong. I'm sorry, Janice.
It could, may not.
Okay.
And again, that's one of the things that it needs a little further explanation.
Okay.
And I don't want to drag your medical history or what's going on with you into this discussion, but I'd be more than happy to answer you offline.
Okay. Two and Steph said, I have severe COPD Gold 3, as well as an arrhythmia with syncope. Oof. My action plan for flare-ups is an antibiotic and a steroid for 5 days. What are the issues with taking a steroid often over the year? That is an excellent question.
Yes. Steroids raise your blood sugar. So if you have diabetes, it can actually raise your blood sugar to potentially unsafe levels. If you don't have diabetes, it can still raise your blood sugar. Steroids can also weaken your natural response to stressors. So it may affect your pituitary gland, your thyroid gland, and your adrenal gland, which are all connected in a axis. Each one works on the other and works as a feedback loop. Steroids can interrupt that.
Okay, I know you're looking at me because you're so sweet, but it's never that way.
Got it.
Okay, and then C had a great follow-up to that. She said, is long-term steroid treatment worth the side effects?
It depends what you're treating. Sometimes, absolutely, yes.
Okay, and what Pink Life asked, what is a good natural treatment for tendonitis in the elbow? Which I just want to say we are going to be doing some homeopathic, and because my husband is actually a DO, so he's a doctor of osteopathy, so his extra education is actually into more holistic treatments because he believes very much in holistic treatment. So that's going to be a whole other thing that we're going to be talking about. So I'm glad you brought that up. But do you want me to repeat the question since I
right now, I have chronic joint problems, knees, elbows, shoulder, and it depends on the type of tendonitis. So if you want a general answer, the thing that works best for me is ointments, liniments, roll-ons that are infused with CBD.
And if you want to know the one that he specifically uses, let me know because it is actually another YouTuber. And we are actually getting ready to make our second order of it because he really believes this works so well. You guys, I see the questions coming up and I promise I'm going to ask them all in order. So don't think just because I don't ask it right away, it's not going to get asked. I promise it will.
And I think that was C that asked about the chronic tendonitis. Again, offline, because we don't want to bring all your medical issues online. Offline because there's different tendons, so there are.
No, that was my Pink Life that asked about
my
the
Pink
tendonitis.
Life. I'm sorry. Yeah. Okay, my Pink Life. You can again offline ask about the tendonitis because specific tendinopathies can also be treated with bracing and certain types of physical therapy. So, great question. We look forward to getting a message from you so that we can answer you more specifically.
C asked, is Doctor on Demand a good source?
I have never consulted it, so I don't have an opinion.
I'm gonna say no, hun. I'm gonna go with no. That's not a great way. That's somebody that's. I'm just gonna say no, and leave it at that. Unless that's worked for you, and then hey, whatever works for you is ultimately the best medicine, right? So what works for me doesn't mean it's going to work for you. So if it works for me, it doesn't mean it's the best or the right thing. The best medicine for you is what works. Ultimately, that's what we all want, is something to work.
And if Doctors on Demand have a lot of lawyers, no, it's a great
Great idea.
Great idea.
Okay. Hey, Misfit Jenny. Do you believe that turmeric works great for inflammation? It's a great question too.
Does turmeric work great for acute inflammation? No. Does it work fairly well for chronic inflammation? Yes. Yes, it does. So chronic inflammation is like those joints, aches, and pains that we have and develop throughout life because we've got minor injuries throughout our younger years that we just kind of walked off or played through. So little tears in the articular cartilage of our major joints, like our knees, shoulders, elbows, even wrists, and it can decrease the inflammation over a period of time. If you said, hey, I like the other question, I got tendonitis from working in the garden or from shoveling snow, I would say the turmeric isn't a acute treatment for that. But if you are shoveling your snow or if you're a gardener and in the spring you notice that you keep getting the same pain in the same joints, I think it is a good supplement to take. Yes.
Okay, and the next question that we had come in was from Misfit Jenny, and she said, "Can I ask what is his best recommendation for quitting smoking?"
I think you should feel that one.
Okay, I smoked like it was my job for many years. I've always been able to kind of lay it down, but it was because I always knew I was going to pick it back up. So I think that's why I was able to quit cold turkey so many times on my own. However, this last time I knew that it had to be done. And I will say, in all of my years with him, he didn't like that I smoked. He used to do some ridiculous shit to my cigarettes that would make me so angry. Like, he used to put in the ER, like, we would have hazard, if it was hazardous waste and stuff.
Biohazard.
Biohazard. They'd so he would wrap my cigarettes up. And at that point, they were like $2 a pack, right? I'm making like $13 as a paramedic, and he's making a whole lot more as a doctor. So I wasn't. But he would suture them closed. He would do all kinds of crazy things. He finally gave up, and he never really gave me any true heartache about it. But it's obviously not good for you, and you do want to quit. The reason I was able to do it is, number one, I had incredible people standing behind me. I had Shell and Alex and Cat's Rule and Artsy Fartsy and Steph. I mean, those ladies were right there. Jen, they were all Holden. I mean, they were all right there every single day to help me through it. And I don't know how I would have done it without them. But ultimately, vaping is what I still do. I don't have any nicotine anymore, but I still love the vaping because the biggest fear for me was I was going to get enormous, and I just didn't want that to happen. And the vaping helped me to prevent that.
I'm going to go on with this.
Let me just real quick. There's only a couple more questions, and then okay. What is? Oh my gosh, I don't even know what that word is. Ombudsman's role in a hospital. My experience is that they are only to try to diffuse a situation, but no action.
Right. The ombudsman, it was originally a position that should be filled by somebody with some medical knowledge, but they don't necessarily have to be a medical professional. They don't have to be a paramedic, a nurse, doctor. And what they're supposed to do is they're supposed to make sure that the patient and the patient's family is getting all of the answers that they need, that they're getting them in a timely fashion, and that they're being updated on the current condition, the current treatment plan. A lot of emergency departments use ombudsman simply because the emergency departments are seeing such a large volume of patients that it takes time for the doctor initially to see the patient. It takes time for lab results to come back. And when they come back, a lot of times there is a delay between the return of a lab or radiologic result and the return of somebody to tell them what the results were and what the next step is. So I think ombudsmen are a good fit for, especially an emergency department. They just need to be empowered a little more so that they can work with the medical professionals on a more equal footing.
Okay, I'm gonna ask the one last question that's here, and then you can go on and finish yours, and then you guys keep the questions coming. We love them. I'm gonna keep track of every single question, and I promise after he gets through the rest of this, we'll come back and we'll answer absolutely every question that was asked. I don't care how long it takes. We'll stay and answer every single question. The last one that I wanted to get in there before you go on is for Miss Janice, and she said, "Do you think edibles work versus pharmaceutical meds for chronic pain?"
It depends. It depends on the edibles. It depends on the pharmaceuticals. So I tried edibles twice. Once they were on discount and clearance at the local vape shop, and and I took them right before going to bed. And then I woke up an hour later and I was sure somebody was in the house. And then I was sure that somebody may have been talking to me through the television. So I made sure it was off by turning it on, which only made my paranoia worse. And then I tried to go back to sleep, and then I would wake up like every 2 minutes, and it felt like it had been 4 hours. And I went on like this for 4 to 6 hours, and the paranoia was really, 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 really unpleasant. So it depends on your edibles, it depends on your tolerance, and it depends on what your prescribed medications are. It's a good question, and we will definitely broach that subject when we're talking about the chronic pain.
You okay, we see you said that she used to roll up post-it notes and stick a piece of unchewed gum on the end of it for flavor and puff on the air to help with her smoking urge, and that's actually brilliant. I used to put a dryer sheet on the end of an empty toilet paper roll so that my parents couldn't smell the pot. So you're genius. That's brilliant. Good. Hi, Clancy.
Yeah, instead of a post-it note, use rolling paper. Post-it notes and other paper are treated with a lot of chemicals that aren't good to inhale. If you've ever driven by a paper plant, there is a lot of stinkage there. So use rolling papers that are specifically designed, and then stick whatever works to stop smoking. All right, so back to our list. We're going to go on to hospitalizations. Now, you already gave the doctor your past medical history, past surgical history, but sometimes you have hospitalizations that weren't previously mentioned. So it may be redundancy. You may be going back to something that you already discussed, or it may be something that you never thought of. So in my past medical history and my past surgical history, it never listed that I was bitten by a dog and that I had to go through rabies vaccination. And so that's where hospitalizations may come up, where it's not something that was reflected in your past medical or surgical history. It was a injury that you didn't require surgery for, and that you don't have as a chronic medical problem. So hospitalizations are important. Going on, you want to discuss family history. Family history is really important because certain things run through a family genetically. Heart disease, high blood pressure, high cholesterol, certain cancers. So you want to discuss your family history. So that's mom, dad, brothers, sisters. If you know it well enough, grandma, grandpa, and any big problems that may have happened in aunts and uncles. Aunts and uncles, obviously familial ones, not the ones by marriage. Next thing is social history. So it's good that we discuss smoking. Most people hate this question. It's none of your business what my social history is, but it's important. And it's not only social history in terms of do you smoke, or do you use smokeless tobacco? Do you vape? Do you drink? Social history also includes your occupation, because there are certain occupational exposures that may be pertinent to your medical problems or to your medical treatment. So social history is important. Also, if there are certain things like recent change in job or recent stressors at the job, loss of work, you want to discuss that with the doctor, because that may be a added stressor for which you need other treatment, therapy, or referral. Next thing we're going to talk about is your Exercise history. As we all get older, we tend to exercise a whole lot less, and that increases our cardiovascular risk. So heart disease risk, high blood pressure risk of stroke, risk of kidney disease, risk of diabetes, and also the less we use our muscles and joints, they tend to atrophy. Also, under exercise, you want to tell your doctor or any doctor you're seeing whether you're going through any physical therapy or occupational therapy. You want to tell them, I twisted my knee and I required crutches, so now I'm going through physical therapy, and they will look at that as part of your exercise history, and they may be able to recommend a further exercise program, or they may be able to recommend a continuation of physical therapy to increase the strength in your core, especially for people with back problems. Strengthening the core a lot of times will help. So you want to discuss that with your doctor. Now, we get down to why you went to the doctor. And in doctor talk, that's called a chief complaint. And chief complaint can be anywhere from one word to a couple of words, and it's subjective. My belly hurts. I've had headaches. My vision is blurred. I have ringing in my ears. I have dizziness. My knees hurt. I wake up with pain in my shoulder, and when I raise my arm above my head, that is a chief complaint. Then again, in doctor talk, you have the history of present illness. So that tells the doctor that chief complaint, when did it start, how did it start, and what's going on. So when you are explaining it, you want to tell the doctor how long it's been going on. If it's belly pain and it's every time I have pasta or fried food, it might be your gallbladder. So you want to tell them how long you've been having that particular problem, how long you've been having headaches or joint pain, whatever your chief complaint is, how long has that been going on. Next, you want to tell them the duration. When you get the complaint, is it constant? Does it wax and wane? Does it get better, get worse? Are there certain days that you have it, other days that you don't? When you get the pain, does it just last a couple hours, or does it go away after a day, after sleep? Does it get better or worse with exercise? So there you want to discuss the things that make the symptoms better or worse. It's better when I eat. It's worse when I don't eat. Well, that could be an ulcer or reflux, especially if you're having pain or burning in the middle of your stomach and up into your chest. You also want to tell the doctor the frequency. How often does it happen? And the severity. At its worst, and a lot of times the doctor will give you a pain scale of 0 being no pain to 10 being excruciating, the worst pain that you have. Now, again, that's subjective, because the worst pain you have may not be the worst pain that the other person has, or maybe even the doctor. I worked with a doctor that was asking a young healthy person how bad their knee pain was after they fell off of a bull ride at a rodeo. And the young man's answer was, my pain is a 10 out of 10. The doctor then informed that person that he had been in the military and he was in a helicopter crash, caught fire, broke his pelvis, his back, and his ribs. And yet he went into the helicopter, caught fire each time, but carried out each of the 10 guys. So his 10 was different than the other guy's 10, which make the other guy say, well, maybe it's not a 10. But when you're describing your severity of pain, it is based on the worst thing that you've ever felt. So if you had a concussion and the headache was terrible, and now you're having migraine headaches and they're an 8 out of 10, that is a good way for the doctor to gauge how bad this is. The other thing is, you want to tell the doctor if you have treated your symptom, how you've treated it, and the response. It got better, it got worse, it didn't do anything. Then you want to describe, in terms of chronic things, You want to describe your quality of life. I get these terrible headaches and I'm not able to get out of bed for 3 days. That's pretty poor quality of life. Or I have this back pain. I can't bend over. I can't pick up the kids. I can't bend down to pet the dog. I can hardly get up out of a chair by myself. That is something that affects your quality of life. And you want your doctor to know that. It's subjective to you, but it gives him an objective scale to see how you're doing, how bad this is. And if he's treating you, you can say, well, now I can pick up 10 pounds, I can pick up 20 pounds. Pain doesn't wake me up at night. So all of those are important when discussing your medical problem. If you are going in for a acute illness, you have a runny nose and a cough, or you have some gastrointestinal problems, you want to tell your doctor if you've had any sick contacts or if anybody else in the house is sick. If you went to a street vendor in downtown Chicago and you got some hot dogs there, you and your family, hot dogs, Chicago, they're delicious. They're best in the world. But then the next day, in 24 hours, you start throwing up and having the runs. Well, you and your family may now have food poisoning. So that's important. Other people that are sick right now, or if you know that you had sick contacts, you went to a party and one of the small children had chicken pox a couple days later, and now you have a rash that looks like it might be shingles. So that's important in the history. And then the last thing, and I'm going to catch my breath and you're going to ask some questions and we'll get right on that. Last thing is travel history. And when I say that, most people say, well, I haven't traveled out of the country. There's a lot of things that happen in the country. So let's say you, in the fall, you went out to Colorado, you went hiking, and you found this pristine stream. It was definitely glacial water running down, and you drank a bunch of it. It was so refreshing. And 2 days later, you had terrible abdominal cramps and really bad loose stools. That's the nicest way that I could think of saying that. Then you probably have something called giardia. So that means that upstream from what you thought was a pristine glacial runoff were some beavers that built a dam, but then they also followed the water with little parasites. You drank the water, the parasites go into your GI tract and they multiply and make you miserable. So not only foreign travel where you may have an endemic illness. Let's say you went to sub-Saharan Africa and you missed a couple of days of your medications and you came back with fever, chills, muscle aches, joint aches, headache. You might have malaria. So that's important too. I enjoy telling stories. I know we're running a little late, but we'll break out some stories. Everybody likes interesting stories. I also did wilderness and environmental medicine. So there are a lot of stories that are outside of the normal medical practice that we'll discuss and have fun with. And now I got it in under an hour and we're all questions. Thank you for listening. And now I get to listen to you.
Well, I'm just going to read the questions and you're still going to do the talking. So Clancy said that he does chewing tobacco.
Okay.
Tobacco. I don't know why I said put an A at the end of it.
Because you're from Cincinnati.
Stop it. Make fun of my accent. Make fun of your stupid Chicago hot dogs.
Oh, nobody makes fun of Chicago hot dogs.
Okay, so what about dipping?
There's different kinds of dip. There's the leaf tobacco, and then there's what people call dip, which is that really fine cut stuff like Skoal and Copenhagen. All of them increase the risk of oral and pharyngeal cancers. They can lead to tooth loss because they actually irritate the gums. That's why you get absorption of the tobacco and the nicotine, is because they irritate the gums a little bit, get into the capillaries, and then you get that nicotine and the little rush from the nicotine. So all of them can cause dental disease, periodontal disease, which is your gums, but they can in the long term also cause oropharyngeal cancers.
Okay. C had asked this is a great question too. What if you don't know your family medical history because you were adopted or you're not in touch with your family or whatever the situation may be?
That is the answer. Adopted. That'll be on your on any chart. Adopted, and then nobody's going to ask you family history.
What about the 23andMe and different things like that that you can take now that shows kind of what things that you are predispositioned to without knowing your family lineage or whatever? Would that be helpful to go through one of those to find out what you are predisposed to?
It can be helpful. It depends on what you think about the DNA programs. They are accurate. There are some upsides and downsides. The other thing in family history is most people say I was adopted, so I don't have any family history. But if you have children, they're part of your family history, and you should also list any medical problems your children have. Hopefully they have none, but they're also part of your family history.
Okay. Let me find WCU's. Sorry, you got it?
Yeah, I got it.
Sorry, you guys. I had him. I'm working on his phone, which is, believe it or not, actually older than mine. So it's not great. We see you said I wasn't inhaling it, laugh out loud. I never put fire to it, just air.
That was a good answer.
Okay, so we answered the chewing tobacco. So funny. Thank you for coming, Craig. We appreciate it. It's nice to have people from Australia.
That was great comic relief.
Yes, that was pretty funny.
I never put fire to it.
She's funny. She said, I had a desk job for years, and since I've quit, all my back pains went away. Was it bad posture?
It is mostly bad posture, but it's also bad chairs. You need to get a chair that actually gives you lumbar support, but you also need support under your legs, and it really depends how you work. A lot of people, despite having a great chair, will hunch over, and sorry to scare you by coming at the screen, but it really is about bad posture, but it could also be just chronic degenerative changes. All of us go through degenerative changes where the joints break down and we lose fluid the older we are. So if we lose fluid from between the pads, between the vertebrae, the discs, that can actually lead to chronic back problems, even if you've never had an injury.
Okay, the next is from Pink Life again, and she said she wanted to ask, she was getting the jab for the virus, and she asked the nurse to aspirate the needle, and she refused. Why the refusal?
Run that by me one more time.
She said that she had asked the nurse before she got the shot if she would aspirate the needle, and the nurse refused. She wanted to know why the nurse would refuse to do that. Why would they aspirate it, though?
She's talking about when...
Do you mean clear the...
No, she's not talking about clearing the bubbles out of it, or she might be. But what I think she's saying is you stick it in, and then you draw back to make sure
you're not in a vein.
Because it makes sure you're not in a vein, because you don't want to mainline.
Yeah, you know real
don't
fast.
Don't want to mainline most medications.
You'll know real fat. When I first started working in the ER and I started, it was probably like under 10 IVs that I had started. And I put it in, and you always wait for that flash so that you know that you're in the vein. And then you pull back a little bit just to make sure that you're in the vein. My entire syringe filled up with blood, and I remember the nurse that was with me. She's like, "You're in. Go ahead and pull back on that one. That's too good." So I see why you would ask that. I don't know why they would refuse to do that. Arrogance, maybe. I don't know.
Yeah.
Arrogance,
don't tell
likely.
me how to do my job.
Right. Let's see. Oh, and Misfit Jenny said that during the last stream you had mentioned to have a list of written questions ready, and that she's never going to forget that now.
Excellent. That's the best way, because then you remember everything that you wanted to tell the doctor, but also everything that you wanted to ask the doctor. Yeah, that's great.
And we see you said, Mandy, I used to try to get a doctor's note so that my employer would allow one of those desks you could stand or sit up at. Doctor wouldn't give me a note, sent me to PT, which worked, but why is it so hard to get notes? Laugh out loud.
Depends on your doctor and what they're willing to do for you.
Seems pretty ridiculous. And then Misfit Jenny said, I get it. Nobody makes fun of her Philly cheesecakes or cheese steaks. Wait, isn't that where cheesecakes are from too? Or just cheesesteaks? I don't know. They're both freaking delicious. Whoever makes cheesecakes, well done.
And Misfit Jenny, Philly cheesesteaks are not as good as Chicago Italian beef. You need an Italian beef, double dipped with sweet peppers. You'll never go back to a Philly cheesesteak again. I guarantee it.
I don't like them. I think they're gross. And when I went in, I wanted just a plain hot dog.
No.
I wanted a chili cheese sandwich, which is just the chili and the cheese and the bun. It seems pretty self-explanatory to me. Chili cheese sandwich. And I asked for ketchup. Not only did they refuse to give it to me, they got on their little speaker thing that they all talk to. They're out there and they're like, did you hear what she said? She wants what? She wanted ketchup. Can you believe this person was like, I was mortified. Absolutely mortified. So I don't even ask anymore.
You don't put ketchup on a hot dog.
I put ketchup on whatever I want to put ketchup on. Ketchup is amazing. Ketchup and pot are amazing. I don't need anybody to take either of those two things away from me. All right. Okay, are there always warning signs one might get an MI?
No, there are what are called silent MIs, but most of them, most people that have MIs.
Hi, Darlene.
And MI is myocardial infarction. It's what most people call a heart attack, where you have the crushing chest pain, but there are anginal equivalents. So angina is pain, and anginal equivalents are pain that is not necessarily what you see or gets described in a medical book. So you may not have pain right in the center of your chest. You may have pain in the middle of your belly. You may have pain in your shoulders or arms, neck, jaw, inside your shoulder blade, in your back. You may have no pain at all. You may just have intractable nausea, vomiting, and that's because the bottom part of the heart lays against your diaphragm. On the other side of the diaphragm is your stomach. So the nerve can't differentiate between your heart attack pain and your stomach being irritated, so it makes you throw up. Another sign of a MI or heart attack is passing out. So anybody that passes out and says, I just fainted, you need to get that checked out. Just passing out usually doesn't happen, and it can be a abnormal heart rhythm. It can be problems with your heart circulation. It could be a stroke. It can be a seizure. It can be anemia. It can be a lot of things. So very good question. Do you always have symptoms? No, you don't always have symptoms. Usually you have something that tells you that it isn't right. And when somebody comes to especially the emergency department, and says, I just don't feel right, or I feel like I'm going to die, I would say take them very seriously. People have a intuition, and when they say, I feel like I'm going to die, or they reach out and say, please don't let me die, it's time to
amp it up.
Yeah, as Amaral Lagasse says, kick it up a notch.
Yeah, that's definitely one of the very first things that we learned in medic school. If someone comes in and says, I'm going to die, or please don't leave me alone, I feel like I'm going to die, take that very seriously. That is almost never an attention getter. It's almost always that they know. We have this instinctual drive that God put inside of us to live. So if we, and if you feel that way, speak up. I promise they will listen. There was something. Hi, Boho said to say hello.
Hello, Boho.
Misfit Jenny puts ketchup on everything. We are going to get along fantastically when you and Wog come to Florida. Wog is saying he will not go anywhere near the sharks. How many times have we heard that? Katie also said she wouldn't go near the sharks. She kissed one. Oh, if I could do that over that trip. Hmm. Darlene asked if aspirin can really stop one, but real quick, I just want to put a little asterisk in there for you to go on into this next phase, because when they asked about the heart attack, there are several different types of heart attack, but the two completely different is one could be electrical, whereas the other would be mechanical, and those are completely different. So your symptoms would be completely different as well. So you could maybe just quickly touch on that.
So heart attack is a broad term. So some people say, crushing chest pain, I got short of breath, I had a heart attack. Other people, like the young man that was playing football for the Bills, DeMar Hamlin, they said he had a heart attack. No, he had a cardiac arrest. His heart stopped. And if you have a heart attack where the heart isn't getting enough oxygen and you ignore it, eventually that will lead to cardiac arrest. And another thing, and this is a big sticker, especially with Amanda and I, when somebody says their cause of death is cardiac arrest, the answer is always yes. Right. Yes, that is always the cause of death. When your heart stops, you are DEAD, dead. So that is not a big surprise when you hear that on a true crime show.
Drives us crazy when they say that.
The manner of death is different.
Right. And so that aspirin.
Oh, aspirin.
She wants to know if it can really stop a heart attack. And I'm going to tell you that no, it cannot stop a heart attack, but it's not going to hurt it. Because if you are having a heart attack that is you go ahead.
So the reason they say aspirin for a heart attack, and if you take aspirin, chew it up, it becomes bioavailable, means it works in your system faster. It may be bitter and not taste good, but it works faster. What aspirin does is, for a heart attack, you have a blood vessel, and normally it's this big, and then it narrows down due to cholesterol deposits. And then eventually those cholesterol deposits crack a part of the blood vessel. Once you get a crack in a blood vessel, it's the same as getting a cut on your skin. A bunch of platelets will go in there and act as a plug. You get a crack in the blood vessel, a bunch of platelets go in there and they form a plug. And if it's already narrowed, that plug may shut down that blood vessel or several blood vessels. And what aspirin does is keep the platelets from sticking together so that it can't form that big plug. So it can decrease the effects of a heart attack, but you always need medical care. It is a good first line treatment. So think of it as falling down and you hurt your wrist and you put a splint on your wrist, but that may not be the ultimate treatment. So aspirin is your first aid, your first treatment, but you need further evaluation to make sure you're not having a heart attack, make sure you don't have a broken, dislocated wrist.
Okay, and Boho said healthcare in Canada is in bad shape. The ER waits are over 8 hours. People are literally dying in our waiting rooms. Yeah.
Okay, do you want
just be honest.
A simple explanation to that is what's called socialized medicine. And it's what is talked about on the news in the United States as Medicare or Medicaid for all, where the only healthcare insurance is from the government. The problem with that is if the government controls all of the healthcare dollars and all of the insurance, then all of the doctors, nurses, medics, everybody is an employee and they work like an employee. If I'm seeing 5 patients an hour because I'm fee for service, then I'm going to try and see 6 patients an hour. If I'm on salary, I may not work as fast. Also with healthcare, so I just read about this yesterday, and it was from the UK, which similar healthcare system to Canada. People dying in the hallways because they can't get them into the emergency department beds to do the initial evaluation to actually treat them. Also, you get rationing of care. So let's say we use a person that's 85 and they're having chest pain. They can't walk across the room 10 feet without having chest pain. In the US, cardiologists be like, we'll take a look, put a stent in. In Canada, they'll be like, we'll see how it is in 6 months. And it's because that's rationing healthcare. You look at actuarial tables, and for an 85-year-old, their life expectancy is actually past what is common for that particular area, country, and healthcare system. And so they're towards the back of the line for any procedures. They may not get heart catheterizations or bypass surgery. They may not even get quality of life care issues like joint replacements for a bad hip or a bad knee. So the systems aren't good. They could be better, but we're not there yet. We're nowhere close to it.
And something else that plays into that, I mean, like Alex said, most doctors truly care about their patients. They truly do. But and the really good doctors knew they were going to do this from the time they were born. That's what they were going to do. But if whatever your choice of employment, whatever it is that you choose for a career, if someone told you, okay, if you go into this career, we're going to pay you this amount of money and that's it, you may not choose to do that career. You may not choose to go to school for 12 extra years if the government is telling you how much money you're going to get to make. And with socialized medicine, that's how it is. So you're not going to get the quality of physicians or nurses or whatever it might be that you would otherwise, because everybody's getting paid the same no matter how much work they put into it. So that's also part of it. There was a good one here.
I have a riddle for you. What do they call the person that graduates last in their medical school class? Doctor. They still get the same title. And you don't know if the person graduated first or last. And if the guy that graduated last is making the same money as the one that graduated first, the one that graduated first may not work as hard. They may not go into residencies that are needed. They may not go into very high-risk residencies or specialties like neurosurgery, brain and spine surgery, or obstetrics. So then you won't have enough specialists. And again, in socialized medicine, a lot of times you don't have enough specialists to do specialized procedures, to do brain vessel surgery, or to do cardiac bypass surgery, or to do intricate orthopedic or spinal surgery.
Okay, here's a really good one.
They're all really good.
These are all great.
Really
a Sea Monkey says, Dr. Lex, have you ever witnessed a soul leaving the body?
I have never witnessed it like visually. You can feel it. You
Amen.
Can feel it.
Yep. Without a doubt. I say that I have witnessed the soul leaving the body because you can tell. You can tell. And now I've never witnessed a fog or anything like that go up and leave the room, but the absolute second that soul is no longer there, even if we're working on them doing CPR, so technically their heart's still beating, their brain is still getting oxygen, we're doing all this stuff for them, so technically their body is still alive, but you absolutely can tell when that soul has left the body without a doubt. And I've seen lots of different patients, and there are a few that I will eventually tell those stories as well, that I'll never ever forget. And if there had ever been a question, which for me there's never been, but if there were ever a question about faith and a higher power, they were answered by what I witnessed working on squad and in the ER as a paramedic or as a physician. You're given such a privilege. I've delivered babies, and I've cleaned up someone that had recently passed away before their family would come into their house to see them. You get to be a part of the two most intimate things that you can do, birth and death. And it's truly an honor, and it's humbling. It is a true blessing. That's for sure. Darling, she didn't kiss more than the shark. Gosh. I have put ketchup on pork chops. I don't really eat pork very much. I learned about like the
Trichinosis.
yeah, and that did it for me. I don't need any kind of worms in my brain. That was pretty much all I needed to hear was that story one time, and I was out. I'm like, I don't really like them. I don't really like pork that much. We see you said at our most vulnerable moments. It's doctors, nurses, medics. They are our heroes, and it's one of the most noble professions. I appreciate you guys so much. Respect. Thank you. You're such a sweetheart. I love you. You already know that, though.
Of all the things that I did in medicine, I can't think of anything that was more powerful than holding somebody's hand. Whether it's the patient, the family, both. It's like Amanda said, very, very humbling that they allow you into their lives to be able to do what we do. And I consider myself very blessed for the opportunity to go to medical school and to practice. And I consider myself blessed to be able to talk to you. I mean, there's a lot of good TV and Netflix on right now, and you don't have to listen to us, but we appreciate that you do, and we hope that we can interact with you, because that's the best part. That is the best part of the medical practice, is interacting with people.
Yeah, and I really appreciate you guys being here for this, because when he became disabled, he lost himself for a little bit there, because he didn't understand he was a doctor. So if he wasn't a doctor, who was he? And it took him quite a while to realize that that's what he did. It's not who he is. He's a healer, no doubt about it. He was put on this earth to heal, but you can do that in so many different ways. And so when this kind of kept coming up as an opportunity for him, I'm so glad that you guys have the interest and that you're showing up for him. And people are watching the replays and stuff. It makes me so happy that he gets to continue to do what I am certain God put him on this earth to do. And I just love him to pieces. I know. Plus, he's super adorable. Okay, let's see.
If you see me squirming, it's because the dog's behind me stretching out.
Boca is back there because if we put her anywhere else, anybody that used to watch my makeup, she doesn't stop barking. This is an odd little puppy. As soon as Alex became disabled, she stopped caring about me completely and became like his girlfriend. It's the weirdest relationship I've ever seen. She literally just looks at him like it's precious. Like,
She looks
love
at me
her
with puppy dog eyes.
She does.
It's
I mean,
sweet.
everywhere he goes, she's right there. As long as he's carrying her in that little papoose thing, she's happy. In the mornings when I get up and I leave and I go grab my Starbucks, it's her favorite time of the day, because I am finally out of the bed, away. I'm not trying to hug on him. I'm not in her way. That's like her favorite part of the whole day. If I try to come back, she's like barking. She doesn't want me back in the bed because she enjoys him, just all of his attention, all to herself. Jenny had said, "We see you. I completely agree. When I had a miscarriage, I will never forget how incredibly kind and supportive the hospital staff was. It meant the world to me at that moment." Yeah, that's tough. I've been there.
That's one of those vulnerable moments, and you'll remember it. You'll remember it either with the grief and the loss, but knowing that somebody there held your hand, said, "I'm sorry for your loss, and we'll do everything we can to make you as comfortable as we can, and make sure that we get you into a doctor that can take care of you when you're preparing to get pregnant again." It's again very humbling, because you have to take on a little bit of their sense of loss to be able to talk to them in a way that is sincere.
Right. I mean, for a lot of things, there are no words. I mean, we have suffered miscarriage, and I had suffered one previously due to my ex-husband. So two completely different situations, both horrible, just absolutely horrible. And I just have to always remember that they're with the best babysitter they could possibly be with until I get to be with my babies. Jesus has them, so they couldn't be safer. That's awful though. There's not a day that goes by. You always think of them. They're still your children. They will always be your children. With ours, the twins, I had them named. I knew what college they were going to. I was gonna do a home birth, all kinds of crazy shit. I mean, I was crazy when we were doing it. But I know now why. I know now why, and I do believe everything is for a reason. And I know that God, he knows best. He knows the whole book, not just the chapters. I can only go page by page. He knows the whole entire book. So I may not like the chapter that I'm in at that time, but I love the author, and I know how it ultimately ends. So I trust that everything will be fine. There was something else that you had said. Oh, when he was at home, that was something that I was telling him, is that he even though he's no longer practicing in the actual clinical part of it, he's still doing lectures. He still helps all over the place with different stuff. But I told him, anytime a holiday comes around, a Thanksgiving, a Christmas, a birthday, we certainly can't remember every patient that we ever took care of. But I guarantee you those families remember him because they still have that family member sitting there that day. And whatever that holiday or that special event is, they're going to remember that he was there when their loved one needed it, and because of that person is still there on that holiday. So we may not remember everything, but other people are certainly going to remember. She is, can you all hear her? That she is literally snoring so loudly. My gosh, it's crazy. Thank you, Jenny, for reminding everybody to hit the thumbs up. We appreciate that. And yeah, Boho, you're short of staff because they fired a lot of nurses and doctors for not getting the job. She's in Canada.
Does she like the Montreal Canadiens?
Oh, geez.
It's important.
She said, we're under Trudeau. Enough said. Boho. I didn't realize where you stood politically. Maybe it's because you hated me for how many years? 6? Almost 7 years? I'm glad you like me now. I wear people down.
It's probably mostly due to me.
Oh gosh. What, she likes you now because of you? She likes me now because of you? Yeah, it makes sense. Perfect sense. I'm sure that's what it is. Hi, Kaylee. Jana said, Boho, my cousin is a mayor in BC and she met him. Not impressed at all.
Highly recommend British Columbia. Very nice part of Canada.
I've never been there. I've only been to Windsor for the gambling. And I just remember how incredibly enormous their police were and that they didn't need guns. Those guys were huge on their horses and pretty like imposing. They were, I don't know, I was like 18. I was just a kid, but I definitely remember that. Justin Trudeau's the worst thing that's ever happened to Canada. Okay, Christy, I'm just hopping on. Are you taking questions? Yes. If so, I'd love to know your thoughts on the mental health crisis in the U.S. As recovering of opiates, I can't get the help I need for debilitating anxiety. Oh, yeah, Christy, hopefully it's starting to actually get a little bit better. It's kind of like they did this. It's the way they do everything, right? They go from one extreme all the way to the other extreme. So when I was practicing and when we were together in the ER, if someone came in and said that they had pain, you literally could get fired and lose your license if you didn't give them pain medication, because who are we to say if someone is or isn't in pain, right? That's not, we can't do that. Well, then they said, oh, everybody's addicted to opiates because they were telling everybody, write these scripts. And then all of a sudden people are addicted and they're saying, stop, no more writing scripts. Not even like the doctors weren't allowed. So it was basically you would lose your license if you didn't give them the medication. And then it went to the polar opposite of you're going to lose your license if you do write them prescriptions. So it took the control away from the physicians completely, which is asinine. None of these politicians went to school to be a physician. They should have absolutely no business in your healthcare, which is again why I'm very, very against socialized medication or medicine. I would love for it to be free. I would love for it to be free, but you get what you pay for, and that's just a fact. And I not a fan because of that right there.
Who was the young lady that asked that question?
Christy.
Earlier in the live chat, I said that one of my future topics is going to be addressing chronic pain and also chronic mental illness. So there is going to be an entire topic on it that I researched, and I look forward to having you in the chat for that one. Also, ask questions.
Yeah, anytime. You can always go back, and any questions that you guys think of later on, just leave them in the comment section, and I will make sure that he's writing them all down. Like, it's been great since he picked the topic. He's been like all into it, studying up and researching this, and it really lit something inside of him that I am super, super happy to see back. So thank you guys. Please keep the questions coming. This is a good thing for everyone, and I'm super, super. I'm very proud. I'm very proud of all of you, and I'm super proud of my sweetheart.
Couldn't do it without you. None of it.
Well, I'm like you said, I'm the second wife. There are no divorces for second wife. We usually just end up in an ocean, so that's not gonna happen. Plus, he's all right. I think I'm gonna keep him around.
While she's perusing that,
yes.
And we just discussed medical advocacy and, being a strong advocate for yourself. It is also being a strong advocate for the family members that can't speak. So the people with developmental disabilities that are part of your family or friends, children, and your elderly family members. You need to be an advocate for them because they may not be able to speak, or they may not feel comfortable speaking, or they may have some cognitive delays, or they may have some dementia. So you have to know their history and also be able to go with them to appointments so that you understand what their treatments are. And what I wanted to say is that I want all of you to be good patients. I am a very bad patient, and the only way that I probably survive is because Amanda makes sure that I take care of myself when I kind of stray off the road.
I told him you need to go see a doctor. He's like, I just saw one this morning. I'm like, what are you talking about? I looked in the mirror. I was like, that doesn't count. Like, no, take your medicine. He puts it off. It's a whole situation with him. He is right. He's a terrible patient. Terrible, but a really good guy. So I'll take it. The next thing that I saw, I think it was Darlene that said she said, I would bet everything I own my sister Spirit visited us before she was taken off life support. Without a doubt, I believe that. Yes, without a doubt. Because like I said, the body itself could still be alive. The brain we're electrical. So the brain is still firing. Technically, it's still firing, but it doesn't. It's not. The soul's gone, and you can tell. I could physically see when what we were doing wasn't going to make any difference. I saw it with my grandmother. I saw when my grandmother passed. It was the most peaceful thing I'd ever seen in my entire life. I'm so grateful that I was there to see it. So, Darlene, I don't doubt that for even a second. I absolutely believe that. Kaylee said that her husband almost died 2 months ago from a major heart attack. They're all major heart attacks, and you hear that people will say, oh, it was just a minor heart attack. There's no such thing as a minor heart attack. In fact, the heart will continue to infarct until it's corrected. Like it will continue to die that part of the heart where the attack is happening, it's where the infarction is, it will continue to die until it's corrected. So when people tell you that you've had a minor heart attack, get a different cardiologist, because that's not correct. They shouldn't say that. Let's see. Love you too, Kaylee. It's so good to see you. While COVID was going around, nobody could even go to the hospitals to be with their dying loved ones. It was a disgrace. That was without a doubt one of the
horrible
worst times ever.
And that does reflect on advocacy. When family members are with their loved ones, they ask questions, they make sure that the people are getting their medications on time, they're getting their personal care. And I know most hospitals, most healthcare facilities do their best, and we're doing their best during a very difficult time. But I don't think that the healthcare was as good during the pandemic as it was previously, and hopefully it comes back to the level it was before.
Janice said that you're still doing God's work, Dr. Lex, and thank you.
No, I thank you. I thank you for watching, for participating.
Healing is truly a gift, not just physically, but emotionally as well in that moment. Absolutely, Misfit Jenny. Kaylee says, appreciate you, Doc. We see you. Love you, girl. Darlene said, Boho Chick, yes, it's heartbreaking. I had to say goodbye to my sister over the phone. I am so sorry, Darlene. I am so sorry. I pray that we are past that horrible part of that's all. I mean, that's one of those things, right? That's one of those things. There are no words. It's just awful. Darlene says, thank you guys. The 21st will be a year, but grief comes in waves. I'm getting better. Oh, I don't know how you're doing it. I have a brother and a sister, and I am lucky to still have my parents, and I truly, I cannot even imagine. I'm very close to my family. I'm very close to his family, and I cannot even imagine what that's. I can't think about it.
I'm glad you can explain that the dog's behind me, because there's sounds coming out from behind me that I hope nobody misidentifies.
Right, because I would just sit here and be okay with that. Never in our entire relationship, but I would just suddenly be okay with that. Please. Says Dr. Lex, have you seen patients do, and wait a minute, have you seen patients do and come back? And if so, what did they decide while they were in in the States? Did they ever mention they saw their loved ones who had passed on? Oh, so you said die. I'm sorry. I see what you're saying, Boho. Man, I'm getting really old. I can't see anything. So she was saying, have you ever seen patients that had died and then come back? And the answer is absolutely, we have.
Yes, we have. But in the emergency department, the people that we call it coding, when your heart stops or your blood pressure drops so low that you're not perfusing, you're not getting blood flow to the important parts, your brain, your heart, and your kidney. And usually if they can be resuscitated, they're brought back. Then they're on a ventilator, and they may be on medications to raise their blood pressure, and they don't usually respond to verbal stimuli. So they wouldn't respond to questions at that time. They wouldn't answer. And then once they went to the intensive care unit or to the cardiac care unit, a lot of times we would lose contact with them. So I never got to talk to anybody who came back from code to see what they actually felt during that time.
Same. I've never spoken to anyone that actually came back from a code. However, I did take care of a child in the ER one time, and the parents were not there. The ambulance had brought her in, and I was in there like kind of cleaning up around and getting her IV and that kind of stuff started, and everybody came in and they did what they were able to do, and she she passed away. But she kept saying a certain name and she had smiled. So when her mom and it was her stepfather, when they came into the room afterwards, and just out of nowhere, her mom said, what did she say anything? Was she conscious? And I said, yeah, I mean, this wasn't the name, but let's just say that she said Karen, and she smiled. And when I told the mother that I said, I have no idea what it means. I thought that, she was, I had no idea. The mother's face got white. I mean, just devoid of blood. And she said that was the young girl's sister, but that they had never mentioned her. She had died before this child was born, and they had never told her about this child. There were no pictures. She had no idea about this sister that she had. And I didn't know this family. So the mom knew I wasn't just pulling that name out of thin air. And that's actually one of the stories that I was talking about, that even if I didn't already believe, that would have made me a believer, because she smiled and she said that person's name. And then the mother said that had been a child that she had lost previous to having this child that she also lost, which is so horrible. And it was from the same cancer. It was like a hereditary, I can't remember what it was, but it's a before they got pregnant with the second child, they had actually said they knew that there was a chance that it had something to do with the two of them combined with their genes. It created some kind of a gene that wasn't great. I can't remember what that was called.
I have no idea. No.
Or maybe one had there was a reason that they were told if they had children again, that it was possible that the child would get this. I'll look that up and find out what it was, but that's one of the stories that I'll never ever forget. The mom was white as a ghost, but I know that made her feel better, because she knew that her children were together. It was trippy. I'll just say that it was trippy. It tripped me out. That's right, Darlene. We don't understand his will. That's right. But that's where faith comes in. That's right. You don't walk by sight, right? That's what faith is. You don't believe what you see, it's believing in what you feel. I used to be a mod for Trisha, never hated you, hon. Oh, Kayleen, such a sweetheart. I think most people in chat or online have at one point been a mod for Trisha. I think we were all mod for Trisha at one point. Boho said, I'm in Alberta, right next to BC.
Very nice. So you're a Flames fan.
Janice said, they punished legit patients that had no addiction problems. Thank God my PCP didn't do that. Absolutely. And the doctors don't want to do it. This is one thing Alex and we've had this discussion. Literally no one has ever overdosed from their prescription of pain medication. I mean, like benzos, yeah, that'll kill you. You can't stop that. That'll kill you for sure. There are certain medications that you absolutely will kill you. Opioids, they're not, you're not going to die fast by taking an entire bottle of Vicodin or Percocet. Unfortunately, you're going to die pretty slow, because you could wipe your liver out, and that's a horrendous way to go. But you're not going to overdose from that. I mean, at that point, if you're literally taking an entire bottle to feel the effect of the opioid, you have a high tolerance. Why people are dying is because they took their pain medications away from them, and they were going to the street to try and treat their pain because they have legitimate pain. So I blame all of these deaths from taking away the patient's prescriptions. I blame it on the government for taking it out of the people that went to school for this very reason, of the doctor's hands. Nobody should have a say-so over your healthcare except for you and your treating physician. That's always going to be this whole thing is messed up.
And another future live stream that I hope to have is on the drug fentanyl. And everybody hears about fentanyl because it's coming into the country, and they use it to cut other medications, to cut illicit drugs, and as an additive to increase the strength of the drug. Let me tell you that fentanyl I used multiple times in the emergency department. Well, I treated patients with fentanyl. Treated patients with fentanyl, and it was a great drug because it could be used in such small dosages. It was ultra fast acting, so it had a fast onset, but a very short half-life. So it didn't stick around for long, so it didn't depress the blood pressure. It didn't depress respirations, which is what some of the stronger opiates and opioids can do. They can drop your blood pressure and drop your respiratory drive. And fentanyl didn't do that because it was used in small dosages, and it was ultra fast acting, but not long acting. The fact is that now they're adulterating this, and they're not chemists or doctors. They're putting it in however much, and there might be a couple micrograms in this one and a couple hundred in that one. A couple probably won't do anything to you. A couple hundred will kill you.
Right, and it's going to be those that have no tolerance for any opioid whatsoever, and so even when I was still running as a medic, that was just starting to be an issue. Back then, it was the patches, and they were putting the fentanyl patches on, and you would ask a patient, well, what are you on? I'm not on anything. And then you roll him over, and it's got 15 of grandma's fentanyl patches on his back and can't understand why he's having some trouble breathing. That was like just the beginning of the issues. But instead of dealing with it appropriately, patient by patient, they just went across the board and created an entirely different situation where people are killing themselves because the pain's too much. So, I mean, I understand. Yeah, prescriptions, it's an issue, but I'm never going to be okay with anybody else telling someone how to do their health unless it's the patient and their choice of physician. And I always say, if your doctor is not giving you the answer that you're looking for, if he's not listening to you, may not always give you the answer that you want to hear, that's a good doctor. But if you don't feel like you're being heard, then you need to find a new physician. Absolutely, because that's a very intimate relationship that you have. It should be one of the closest relationships with people that you have, because they are in charge of your health. You are, and you're looking to this person to be the one to kind of facilitate that. So make sure that you choose a good one.
And Janice said street fentanyl is killing people there. I'll tell you, it's not only a big city problem, it's an every city problem now. And don't quote me on the statistics, but it's roundabout 2 years ago, it killed 60,000 people in the United States. Last year, around 80,000, or 3 years ago, 60, 2 years ago, 80, and last year it was around 100,000. Goes up again, 120,000. It's an epidemic. It's a pandemic. To use an overused word, it is a pandemic, and it definitely needs to be addressed. Part of the good thing is now that almost every first provider, so not only paramedics, EMTs, but also street patrol officers, are carrying the antidote to opiates, the Narcan, and I'm not sure if it's states or communities, I'm not sure at what level it's coming in, but Narcan may be available free of charge from any pharmacy without a prescription.
And just a real quick thing on the Narcan, which is a wonderful drug. I've used it many, many times. It is fantastic. The person that's getting it will probably disagree pretty strongly when they first come out of it, because it does send you in immediate withdrawal. However, the one thing I had so many patients and even their families that would say, well, they're better. You gave them the Narcan and then they would take off
Very
and
good
go.
point.
The thing is, the half-life on the Narcan is much shorter than the half-life on many narcotics. So what would happen is the Narcan would wear off. They would once again overdose, even if they hadn't taken more. But usually what would happen, I just killed their buzz. They'd go out, get some more drugs, do it. When the Narcan, they would keep doing it because they still had the Narcan in their system. As soon as the Narcan wore off, they got a dose that no amount of Narcan was going to be able to reverse. So regardless of if you are able to get Narcan to someone, they absolutely still need immediate medical attention. So do not think that they are good to go. They need to be seen and treated and watched closely.
It's not a cure, it's a treatment.
Right. It's life-saving. It's a wonderful, wonderful, wonderful drug. But just know it's not a substitute for emergency care. It's a time. It gives you a little bit of time. Janice, here's the snoring. I know we're going on 2 hours. I see it. Yes, I absolutely believe that you can train your brain to fix certain things. I know that you also, that's actually something that we'll talk about.
Biofeedback.
Thank you, Kayleen. We are so glad that you're here. Is it true that hearing is the last sense one has? I don't think so.
Now, it's hard to say what the last sense one has, because most of what we describe as senses are cortical activities. So cortex is the covering of anything. So in this case, the cortex of the brain is what provides sensation. The nerves are much deeper, and they may die at any particular rate depending on where they're getting blood flow. But in terms of sensation, that's a cortical effect. That's the cortex that is the brain covering. And if the cortex isn't working, the person is technically comatose. So it's hard to tell which sensation goes away last.
Kayleen, I am so sorry that you witnessed that with your husband. Anytime we had to shock someone, that's a traumatic thing to see happen, because it's not at all like you see on TV. That is a very CPR in general is a very violent situation to go through. We've made the choice with family members before to call it, because it's often not gonna change anything, but it is incredibly destructive. You're gonna break ribs. You're gonna, especially when you're dealing with like the elderly and stuff. It's just a tough thing.
Yeah, CPR is a rough thing. Artificial respirations. I think everybody should know how to do rescue breaths, how to do CPR. I would say for people that are involved in their community, business, wherever, they should definitely invest in an AED, an automated external defibrillator. That is a little box, and what you do is somebody goes down, you don't feel a pulse, you don't see them breathing, and you put pads on them, and the machine will actually analyze and say what rhythm they're in and whether a shock is indicated or shock isn't indicated. If a shock is indicated, charges up by itself and says, press this little button, and you press that little button, and then it will tell you to start CPR again. Then it'll tell you when to actually stop CPR so it can do another analysis, see if another shock is ready.
So that's kind of what I was talking about when I said there are like 2 different types of
heart attack.
Heart attack, right? Whether if it's electrical, then an AED is amazing. If it's a blockage, which would be more of a mechanical thing, you would need to be, go in where there's aspirin and those kind of things that you were talking about. That's what I was talking about. If it's an electrical issue, that's an amazing thing, because there a lot of heart attacks are because you have a dysrhythmia when you're in a sinus rhythm, and for whatever reason you slip out of that, and depending on the part of the rhythm that you slip, it can be devastating. So having an AED is amazing. I think everybody should have AEDs. I just personally think certainly every school has them now, churches have them, but I think everybody should have them because they are dummy proof. They really are. I mean, I was gonna say I don't think anybody would do it out of fun, but there's a lot of teenage boys, so I'm sure that at some point somebody would use it and be stupid. But the big thing is that it's not gonna fire if
yeah, it won't allow you
Right.
to do it unless
you have to be.
unless it recognizes an abnormal rhythm.
Yeah.
Now, going back to the question that was a little bit ago about what people thought after they had been resuscitated, after they were brought back from cardiac arrest, I just remembered this story. A young man, he was in his early to mid 40s, came into the emergency department. He said, I've just been feeling terrible all day. I've had these funny rhythms or funny feelings in my chest, like fluttering, and I keep feeling like I'm going to pass out. And as he's talking to me, he actually goes out and he's on a cardiac monitor, and he went into an abnormal rhythm that was no longer perfusing. It wasn't pumping blood anymore. And we had the defibrillator right there, and we got it out and put the pads
I
on
remember this.
and shocked him and brought him right back. And all he knew was this swarthy dark guy standing over him. There's little things of smoke coming up off his chest.
hair. I remember this.
And he said, you, and I'll delete the word, hurt me. And he came up off the bed to try to strangle me. So I know what he was thinking at that time. And then he didn't want to talk to me anymore.
I remember that. That's hilarious. I've forgotten all about that. Oh. Okay, have a good night, Boho. Thank you for coming in. Yes,
Thank you.
Street fentanyl is killing people everywhere. It's awful. Christy, yes, I'm glad that he's going to be doing the mental health. She said she's anxious to hear that. She'll definitely be back for that. I'll make sure and I put it in the title. Like I said, this series is The Doctor Is In, so we'll be discussing specifically like what he's talking about for that subject. And then like this, it's going to get, we're going to answer all kinds of questions. But we could do this every day for 24 hours and there's still going to be questions. So we're excited to do it. What?
And again, Miss Christie, we do welcome suggestions for future topics.
Yeah, please leave those in the comment section. Please do. Absolutely. He loves researching. He loves to read like books that don't have pictures and stuff. Like I still can't believe that I ended up with this guy. He's so super smart. Oh, God love him. Okay. It is. We see they're putting it in everything. It's so incredibly sad. Boho said, Mandy, Dr. Lex and chats. This has been fun. I have to go now. I work in the morning and up at 5 a.m. Have a wonderful night. Yes, thank you. And
thank you so much for being with us.
We appreciate what you do. Thank you for coming in.
Thank you for your time.
Appreciate it. Christy, congratulations on 7 years. I have more respect for recovering addicts than I think I do any other human on this planet because I have seen how difficult that is. And so much respect. I personally have never, I don't have like an addictive type personality, but I have family members that do. I lost my cousin 6 years ago, I think, around Thanksgiving, and I've lost so many people that are really close. And I had someone that was very, very close to me that was addicted, and he beat it. He's still with us, and I am so grateful. So grateful for those that are in recovery. You guys are badasses. Like keep trying. Don't ever let a relapse keep you from we need you.
And share your testimonial.
Please do.
Tell others.
Amen. Jana says, because I have to take an opiate for my back, I have to. I carry it in my purse in case someone else is ODing. Yeah, that's a good idea. Hi, Vicky. She said, hi, Mandy and Lex. Stopping by to say hi and leave a thumbs up. I'll catch the replay and the next one. Much love. Much love to you too, Vicky. Can you buy a defib at home? I think you can get them on Amazon. Like everything. I think you can. Oh, okay. Sure, yeah. Yesterday was 2 years since my dad passed away. When they tried to bring him back, the doctor said they broke his ribs. Yeah, that's very common. Very common. Yeah. And I'm so sorry for your loss.
As for the AED, to have it in general, I think is a great thing. But if you have a family member who has heart disease, dysrhythmia, they have an abnormal heart rhythm, they have a pacemaker, then a lot of times you can be reimbursed for the AED. You don't have to pay for it entirely out of pocket, or Medicare may help with it.
Oh yeah, 12 minutes, sweetie. That's a really long time to go. You made the right choice. And I know how difficult that choice is. I've made that exact choice with my grandfather. It was so hard to make, but it ultimately was the right choice to make. Right, Janice, same. Yes, everybody lifting. Yes, that's awful, Christy. Kaylee, you're such a sweetheart. Oh, thank you. She said, I think you can purchase them on Amazon. There you go. And I saw someone say they were cough. Oh, Darlene said, I was having chest pain once and I was making myself cough hard like a maniac because I heard it could get your heart back in rhythm. God love you. Y'all are the people who keep us in business. Oh my gosh, I'm gonna save that comment forever. I'm gonna have to do like every year, like the best of comments. That's going on there. That is gonna be one of the comments. That's fantastic. Way to lighten the mood. Thank you. All right, let's see. We have just a couple more, and then I think we should wrap it up. I wonder how expensive defibs are. Amazon has everything. That's a fact. Amazon has everything, and I don't know, but I'm gonna look into it because I definitely want to have one. And no matter what the cost, might buy one. Absolutely, because you can't. There's no price on that, right? Like if you need it, and isn't that how it always goes, women? Like we are so quick, like when we tidy up, we throw something away or whatever, like held on to something for like 70 years. And then we're like, why am I holding on to this? I'm going to get rid of it. This is so stupid. And then 3 days later, you're like, son of a bitch. That's the one thing that I needed. That's it. Hoarding everything for the rest of my life. So yes, I think everybody should have an AED. I'm going to do that too. I'm going to get one. I'm going to get on Amazon and get it. Okay. Christy said, thank you, Mandy. Definitely hasn't been easy and will forever be a struggle I fight with every day. Addiction sucks, but it's part of my story. Always will, but I'm going to fight it one day at a time. Amen. I have so much respect for you. So much respect. So that's a no. You guys are so funny. This has been great. Love you, Janice. Well worth the cost. Amen. You can't put a price tag on the person that you love. That's an incredible thing to have. Yes, thank you for this live stream. Much respect. Thank you, guys. I think that I got everything. I will absolutely go back. I will rewatch it like I did the last one. And this is the part where I give you guys the warning that we are going to go ahead and close with a prayer. Feel free to exit out if that's not your thing. We'll still pray for you. I just want to say that I had an overwhelming response from you guys, and I couldn't be happier about that. It's truly amazing to see God working in every way, even in the drama community, even in YouTube. He will use anything to help others, and I think that is absolutely phenomenal, and I love that we get to be a part of this. You guys are amazing. I'm so grateful for all of you mods. Everybody, thank you so much for being here. Alex, thank you for your topic. I will let you guys know when he decides what the next topic will be, and then I'll give you a heads up on my community page and let you know, and it'll kind of go just the way that this one did. So,
and again, please, your suggestions, because it might be your suggestion that comes up next week. It might be your suggestion that a dozen other people are thinking about. So please, your suggestions, and keep the questions, comments, and concerns. Keep them coming so that we can continue to do this. We can make it better, and we can interact with more and more of you in a more personal way.
Yes, and I read every single comment to him. So even though he's not like super great at the computer thing, I read every single comment to him. Please. and I try to respond based on what he has said. So if you see his little emojis, which you decided was going to be, oh, this was a conversation. We literally had a conversation for probably
This is
3
subject to change.
hours. No, it's not changing. You made your decision, and it is final.
It may involve a porcupine, a sloth. You never can tell.
Legit, that's what he wanted me to do. He's like, "What about a hedgehog?" What does a hedgehog have to do with anything?
I like
I don't know.
hedgehogs.
I like hedgehogs. I think that we have settled on, what was it? The fishing pole shark fishing? No, it was shark fishing pole shark. I don't know. Maybe it is going to change. Who knows? Y'all know how I talk. I have the 3 hearts. If it's different, then it's probably not going to be him. I'll just tell you that. Not for a while. He doesn't know how to use any of this stuff. So, all right. I am going to go ahead and close. Again, you guys, thank you so much for being here. We appreciate it. And Alex, thank you so much for doing this. Heavenly Father above, we come to you with a humble heart. And I right now am just so overjoyed for the blessings that you continue to give to each of us. Thank you for bringing all of us together, and thank you for giving Alex the knowledge and the drive to do what he does, and for being so generous with his time and with his knowledge. I know that he truly believes that all comes from you, and I know the joy that he gets from sharing this with others. But Father, I thank you that he's willing to do this. I thank you that you've placed it on his heart to continue to serve his community, our community, as he has always done. I pray that you would be with me and help me to always be supportive and to be the voice that he needs to hear in order to have him continue to do your work. Just help me to make the right choices, help me to say the right things, and help me to know when to not say anything at all. Father, I thank you for all of these amazing people that have shown up in our chat tonight, and there are so many. You already know their struggles. We don't have to say them. You already know everything about us. But God, I just want to lift up tonight so many that are dealing with a very recent death, an anniversary of death. Right now, I know of 3 that have spoken previously or are in here right now that are coming up on the death of their parents or their husband. God, there's just no words to truly comfort them. So I just pray that you would send Jesus, that you would be there, send the Holy Spirit to fill them with that love so that they remember and they know that they will see that person again without a doubt. They are there and they will be with them again. Father, I pray that you would be with those that are suffering with pain, financially, spiritually, mentally. There's so much evil. We know Satan is everywhere. We are not of this world. We just walk in it. But we know that you are with us. And if you put us all together, we can fight anything. And I truly believe that that's what's happening. I truly believe that you are bringing us all together so that together we can stand as one. And with you, there's nothing that Satan can do. And I am so grateful that you give us the opportunity to have this personal relationship with you, not no one that we have to go through anyone else. It is a relationship that we get to have directly with you. And I am so grateful for that. Father, thank you for all these people that have shown up. I pray that you would be with each and every one of them. There are so many that have different things, whether they've spoken about them or not. I lift all of those up. I ask the Holy Spirit to intercede and lift all of those prayers continually while we sleep so that those prayers are never ending. And I pray, I want to praise you for answering the prayer for Miss Nancy. We had a wonderful outcome with her mother, and I just ask that you would continue to be with her to help her heal, and that you'd be with Miss Nancy so that she would be able to relax a little bit now and take care of herself as well. Father, thank you for each and every one of the people that you have brought into our lives. We thank you for our families, for our friends. And God, we thank you for this relationship that we have with you. I pray that you would continue to watch over us and help us to walk in the way that you want us to. I pray these things in your holy name, my God. Amen.
Amen.
All right. Thank you all so
time.
much. Thank you for your time. 2 hours and 8 minutes, y'all. I truly am blown away. Thank you. Thank you. Thank you. Christy, thank you for being here. Absolutely. Yes. We don't know their struggles. We just know that they're there, right? But that's the great thing. That's one of the great things about God. We don't have to say it. We don't have to say what it is because he already knows. And for those of you that have come privately and asked us to pray, please know that you are in our prayer book and that we absolutely pray for you night and day. Alex and I have prayed together for years and years and years. So it's a wonderful thing. Thank you, Janice. Thank you, Miss Jenny. I love you all. Hopefully WOG's going to go live. Do you know if WOG's going to go live? I could use some music. Oh my gosh, it's 10:44. It's like 2 hours past my bedtime.
11:44 on the East Coast.
Hello, Boca. Say good night. Say night nights. There's my little wild child. I swear, doesn't she have Richard Marx hair? Am I crazy? But doesn't she kind of look like Richard Marx? I think that my dog looks a little like Richard Marx. I don't know. It's kind of weird. Sandy's over there. She's been asleep since about 10 minutes after she got up this morning. So, hi, Michelle. Nice to see you. All right, you guys. Everyone have a wonderful night. It was so nice to see you. Hi, Michelle. It's good to see you. Say night, Boca. Oh, Rod Stewart. Oh, don't listen to that. No, we won't have that kind of negativity here. Shoot, I kind of see it too now. Man. All right, you guys. Thank you so much. I don't know how to, maybe if I hit the X. Thank you guys so much. I will check the comments and I look forward to the next time that we get to see you. I'm sure that I'll see you guys all around the neighborhood. Thank you so much for stopping in. Thank you for listening to my amazing husband. I think he is, I think he's pretty freaking awesome. So,
thank you.
All right. I love you guys. Love you all.
Good
Have
night.
a great night. Bye-bye.